afternoon, everybody. You're all very welcome to the session. My name is Jacqueline Whelan. I'm Professor of Nursing, School of Nursing and Midwifery, Trinity College, Dublin. I'm the Chair of the Spirituality Research and Innovation Group. This is the third seminar in our series this year, Revisioning Spiritual Healthcare. We look very much forward to Professor Sílvia Caldeira from the University in Lisbon, the Catholic University in Lisbon, to be presenting her presentation on spirituality and resilience. We'd also very much welcome Professor Fiona Timmins as well, who's a Professor of Nursing and the Head of School of Nursing and Midwifery and Healthcare Systems in University College, Dublin. So without much further ado, I would like to introduce Sílvia to everybody. And Professor Sílvia Caldeira, she is a nurse. She holds a master's degree in bioethics and a PhD in nursing from the Catholic University in Portugal. She's a pediatric nurse and also a specialist in medical surgical nursing in the area of chronically ill persons. And she's an integrated researcher at the Centre for Interdisciplinary Research in Health, where she coordinates research projects that integrate PhD and master's students, linked to the Spirit and Health Project and the NANDA 1 project. The Spirit and Health Project includes research concerning the study of spirituality within healthcare, and the NANDA 1 project concerns the study of nursing diagnoses. And since 2019, she's the coordinator of the PhD in nursing at the Portugal Catholic University for the Lisbon class. So we are delighted to listen and to hear your presentation. And just before we do, I also want to introduce Fiona. Fiona is a huge researcher, and basically she looks at interdisciplinary and international research and works with interdisciplinary and international research teams. And this has spanned over the last 2 decades at least. And she has contributed hugely to the development of nursing and nursing knowledge within the context of our professions. She also focuses in on teaching and learning and professional nursing issues and concerns. So we look forward to Sílvia presenting, and then Fiona will also help us in terms of answering some questions that some of you may have around this presentation this afternoon. And should any of you have any questions, please feel free to put them in the chat function, and I will process them at the end of the presentation with a view to getting them answered. So I hope that clarifies everything for the moment, and we look forward to hearing your presentation, Sílvia. Thank you.
So thank you very much. I just want to validate that you hear me, right?
Yes, I can hear you perfectly.
Okay, good. So thank you so much for this kind of invitation. It's a great pleasure for me to be here with you all, and particularly with this amazing professors. So Fiona Timmins, that was my supervising in my postdoctoral fellowship 10 years ago. Imagine, I was in Trinity College with you, starting this amazing group, spiritual interest group at the time, and now SRIG, Spirituality and Innovation Group, and research. You had the research component here, which is really good. And thank you, Professor Jacqueline, for this invitation. It's difficult for me to say no to you. It's a big yes, and I'm very happy to be here, particularly because I'm talking about a topic that is my research concerned, my research area. And I believe it's very important to healthcare today, and merge two important and how do I say, critical concepts such as spirituality and resilience. I would say that for in a matter of time, and for you all who are participating here, I think it's important to say to you at the beginning, what is my summary, or what do we plan to talk? So first we'll have an overview on resilience and spirituality. We'll try to discuss some particularities on the concepts. Then we will discuss the common grounds of resilience and spirituality, trying to understand how these two concepts are connected, how spirituality and resilience are related, and in the third point, we are bringing this discussion into healthcare because we are in the context of healthcare, and probably we need to focus only on this context because spirituality and resilience are broad concepts and probably can be discussed in other disciplines, in other contexts. But we are interested in discussing these big two concepts in healthcare, as healthcare providers, as healthcare team members, as healthcare educators, as healthcare researchers. So the questions are what, why, and what for bringing this discussion into healthcare. And then at the end, because I believe we should always end some academic discussion or some meeting like this one with an open door. That is why you are here, to open new ideas, to share new discussions. And we are bringing here some challenges and opportunities within these topics for the future. Not all, just some, because this is really a broad theme. I would say that for the first point and topic, if we start discussing what is resilience and spirituality, there's an exercise that I can invite you to do. You can Google resilience and check for images. And if we do this short exercise, you can check that mostly the images are connected to two big dimensions. You have always a context of adversity. And here you can see the ground. It's not a beautiful ground. It's a ground that is not clear. It's gray. You look at that ground and think, how can a flower come from that context? And the other dimension on the images on resilience, so you have the context of adversity and you always have the context of something that is changing, something that happens regardless the adversity. And mostly of the images are flowers, are plants, are something that represents life. Something that has this big message like, keep going, regardless the context of adversity, keep going. There's always a way out. And I'm saying this, I'm not bringing papers, big definitions, citations on resilience, because I believe that in 45, 50 minutes, it's more interesting for us to have this conversation, even a virtual or an online meeting. I think it's more interesting to provoke you to this, to think on the concepts and to stop, move from papers, science, citations, and just think on the meaning of the words, on the meaning of the concepts. So resilience is related to these two dimensions. On one hand, you have adversity. On the other hand, you have changing dynamics of change, aiming this keep going message. But this keep going is the process, and there's a characteristic that is behind this, that is keeping stronger, keep going and stronger. This strength, that resilience is related to is a big characteristic of the concept, because strength is related to dynamics and never break, never break. This is resilience related to resistance on the context of adversity in terms of keep going and keeping stronger. So if you want to look at literature, not just Google for images, you can find that resilience is a process of becoming stronger. So it's a dynamic process of becoming something that is stronger, someone that is stronger, overcoming adversity, but also a result. And this is very interesting in times of crisis, because it's two dimensions that are not the same, but both are very important in our lives, because you have resilience and you are resilient. So you can have this characteristic, but by doing that continuously in your life, by overcoming difficult situations, crises, illnesses, you are a resilient person. So something that is a characteristic transforms in yourself as a person. And this is quite interesting. It's like it's on your skin and is absorbed and transforms you in that characteristic. Because you often say, you have resilience, or you are resilient. And this is quite interesting to think in these two dimensions, because one is more external, or looking at resilience as a resource. The other is looking at resilience as a competency, as an inner source, something that we have and we can manage to use in times of needs. And this is quite different from looking at resilience as something out of myself, as a resource, and not an inner force, something that I have in me and I can work particularly in times of crisis. So the context of adversity, and we all have in our lives, there's no such thing like perfect lives. We all have context of adversity in our lives, in different perspectives, in different contexts, in different periods of life, in different transitions of life. We can have illnesses, we can lose our autonomy, even if it is for a short period. We have grieving processes because we lose people, we lose competencies, we lose skills, we lose characteristics, and that's a grieving process. And there's life transitions, and it's not a bad thing. Sometimes it's something that is natural. I'm not a mother, then I become a mother and a mother of twins. I'm just a girl, then I have a family and I engage in the dynamics of having a family. And this is adverse event. It's a good thing, yeah, but you need to overcome different challenges, and you need that strength that helps you in adapting and overcoming those situations. And the dynamics of change that is related to resilience is related to the growth and the development within these situations, but also relates to the resources that you have while doing or while living this process, because you have family, you have friends, you have community, and this is particularly important for religious community, parish, social small communities that are really helpful in nurturing resilience on people, because we talk about support and network. So being together, supporting, and having these people helping, supporting, being there in these dynamics of change. So resilience is something that could be inside ourselves, but depends on the context, not only the context of adversity, but the context as the resources that are there to support my resilience. So we can talk about internal or external resources to face stress and adversity. On the other hand, and this is a short overview on resilience, which it's very interesting because psychology is the discipline that studies resilience the most. I could say that to you because it's connected to a mental health characteristic or competency. And in fact, psychology and mental health disciplines are the most frequent here. I won't say important, are frequent in studying the process of resilience, but this is a life concept. So and when we think in health and health transitions or illnesses, this is a core concept for all healthcare providers, not only psychologists. I would say this clearly. So let's take another exercise. If you Google for spirituality, that is the other concept that we are talking here today about, is a concept that it's very interesting if you do that now and Google for spirituality and images. Just check the amount of images that you can find. And all the images are related to this sense of feeling. I'm sorry, I couldn't find no word to say this image unless the and it's like we are in peace, we are in pause, we are here with me, with the world, with the ones I love, feeling grace, feeling the transcendence, feeling connected to all that I love, to my life, to the meaning I find in my life and my living circumstances. And this is the word for this images. And you can find others, but mostly the images connected to spirituality are saying what spirituality is in our lives, particularly in health. So it's that dimension that keeps us having this sense of calm, serenity, having meaning in life, feeling and giving love to others, forgiving and being forgiven, having the creativity, because some people like to be with nature, some would love to read some books, music, poetry, and today is the International Day of Poetry. And this is very interesting because you have resilience that we talked before. There is this characteristic related to the strength of overcoming adversity, and you have this side of the coin, I would say the coin, that is the dimension related to the serenity and finding meaning in life. So I would say that spirituality is deep and related to well-being, peace, connection, hope, feeling good, nature, and we need to be surrounded by nature, the world, and others. And COVID-19 was a really spiritual experience on that. We need to stay and keep apart from each other, just in our home, away from other things that help us in this fulfillment. Because we need to be with the others, but we also need to be with self. We need to engage with ourselves, to know ourselves, to have this sense of, I know who I am, I know what I'm here for, and I can find meaning in my life as a one distinct person. That is why spirituality is also related to values and beliefs and transcendence. Transcendence is about keeping this dynamics or the ability of keeping apart from the physical, only the physical things in the world. We can feel something that is not touchable, we can see, sometimes we just can put it in words, but we feel that there's something more that time and that experience we are living in. And these characteristics are connected to spirituality, and spirituality is connected to resilience in this particular point that is looking for strength. Spirituality in our lives, it's a dimension that is, we all have that dimension in life, because all human beings look for meaning, look for love, look for forgiveness, look for creativity, look for peace, hope, connection. But we all live that dimension individually. But that dimension for all of us brings us this sense of strength, sense of connection, sense of being a unitary being. And this is what spirituality is about, is giving us the sense of being human, of being one individual while sharing characteristics with the others, but it's about an individual perspective of being human. When we try now to bring together these two concepts, so resilience and spirituality, we can find this that we called the diamond area. This is something that we choose to call. You can call it the golden area, the silver area, what you want. We call it the diamond area. Why? Because when you merge what's resilience impacts, or how resilience impacts spirituality, and how spirituality impacts resilience, and how they are connected, there's a gray area that is not gray in our lives, for sure, it's diamond, that is very important. And that is why when you look at literature, you find lots of literature concerning the positive effects of resilience on health, the positive effects of spirituality in health, and the related dimension, the relation of resilience and spirituality in health. So this is a diamond area that we should look for as healthcare practitioners, because we are committed to holistic care. Otherwise, what holistic care are we providing? So this diamond area, I would say that we can try to understand better this diamond area if we go back and review resilience, that is about overcoming difficulties and transforming, and this concept of transformation is really important when we talk on resilience and spirituality, and is a powerful resource on mental health. And it's interesting to check that when you look at literature about resilience, you find this integral health concept. So health is not just about overcoming illness, but how do you overcome? How do you deal with that? And for sure, resilience is one big topic as an answer. On the other side, you have spirituality as a dimension in life that is related to the search for meaning, transcendence, and connection with self, other's nature or a superior being. And this brings us to integral perspective. Again, the integral concept. So we are all as a whole. I have my body, my thoughts, my social environment, my spiritual values, and this makes me one individual. This integrity, this integral perspective on the understanding of health and what is well-being is very interesting and describes or characterize the diamond area between spirituality and resilience. And here highlighted in yellow, and it's not for the chance, it's really because we want to highlight the difference between spirituality and religiosity. And it's very interesting to check in the healthcare literature that for 30 years from now, in the 80s, in the last century, spirituality was considered like a dimension of religiosity, and now there was a turnover as spirituality is considered a broader dimension and religiosity a dimension within spirituality. So you can live your spirituality, you can have your spiritual experience in life by living your religiosity, but also with other diverse perspectives on living spirituality. Then we have the agnostics and non-agnostics. We have people that are spiritual, but they don't believe in anything that they just can see. And that's okay. They are spiritual at the same time because they live their spirituality not in a vertical dimension, but in what we call horizontal dimension with others, with the world, with all that they can see. And that's okay. But it's very important today. Well, it's not critical, it's not a problem, but it's important to have this clear concept on spirituality and religiosity. So this integral health, integral perspective on health and well-being is very important to understand resilience and spirituality, a gray area that we call diamond area. Then what you can find in the healthcare literature, and it's very interesting because sometimes you have different concepts to describe the same phenomena, and you can find not spiritual resilience, but spiritual coping. And when you look at the concepts, they are similar because spiritual coping, it's the way you overcome adversity by using spiritual resources. And spiritual resilience, it's that ability of overcoming and transforming while you're doing that spiritual journey. So you have resilience as overcoming adversity using internal and external resources in a dynamic process of transformation and strength. And spirituality as a dimension of life that is related to finding meaning, transcendence, and connection. So you have here lots of opportunities to further understanding of these concepts, whether it's spiritual resilience or spiritual coping. And you find both in health literature. So spiritual resilience, and we are not talking here in resilience and spirituality. It's interesting, there is a concept that merges the two ideas in one concept with one different meaning. Spiritual resilience combines spirituality with the ability to overcome adversity. That is why in some healthcare literature you have spiritual resilience and spiritual coping as synonyms, but we need further research to understand better these different concepts, and more than understanding the concepts is understanding the way patients, family, or healthcare providers understand or live these concepts for patients and family while living illnesses processes, and also for healthcare providers while providing care, because in some contexts it's very interesting to think in the understanding of spiritual resilience in a healthcare provider's perspective. And here I can tell you that, for example, in the research related to moral distress, you have this spiritual resilience as a positive factor in decreasing the moral distress, in dealing with the moral distress. That is another subject and topic, but it's very interesting to understand how spiritual resilience and spiritual coping are related to moral distress in a healthcare provider perspective, which is also very important, I would say. So when we bring the discussion into healthcare practice, because we are in the healthcare context, and this series is revisioning spiritual healthcare, and I would say that Jacqueline and the group is very provocative on that, because when we look at literature on spirituality, the evidence is clear on the absence of spirituality in healthcare. And I won't say that spirituality is not there in healthcare. It is, but somehow it's not expressed in the records. It's not expressed in the way people talk about the healthcare delivery. It's not there. It's not there. It's like a hidden dimension of healthcare, still a critical dimension in healthcare. When we look at the reports on health, whether it are international reports, local reports, national reports, patients, or when we look at the literature, if you look for an evidence-based problem, you can find, and this is like a paradox, because on one hand you have a dimension that mostly is absent from healthcare practice, and I would say from healthcare education as well, not from healthcare research, because interestingly, it's one of the topics that is increasing on publication. And this is quite that is why I use the word paradox, because at the same time you have lots and lots and lots of research. One top area in research today, particularly in palliative care, chronic illnesses, but then still it keeps absent from healthcare practice and mostly from education. So revisioning spiritual healthcare is a provocative invitation, because we need to bring this discussion into healthcare, but we need to move forward into implementation and into specific ways of bringing not only the discussion, but the practice into the discussion. But when we discuss the practice, we are saying that we are doing that already. And here we are discussing still what, why, and what for, thinking on resilience and spirituality, or spiritual resilience or spiritual coping in healthcare practice. We all know that there's a big, I won't say mantra, but all over the world, I would say each healthcare provider would say that has a patient-centered care. These three words are really frequent in our speech, but at the same time, when we look at the organizations, when we look at the structure of the delivery in each delivery care in each organization, we say we have a patient-centered care, and then the whole team members are there connected to respond in a better way to patient needs, patients and families' needs. And then we have all the different supportive professionals or settings or whatever, or resources to help in that patient-centered care. And this is quite interesting because we say this, patient-centered care, and we say we provide holistic care. And we say we provide holistic care. By saying that, we are saying that when we decide in our process of decision-making, and if you are a nurse, if you are a physician, if you are a psychologist, if you are a social assistant, if you are a physiotherapist, if you are an occupational therapist, you use this decision-making process because you assess, you diagnose, you plan your intervention, then you do your intervention, then at the end, you evaluate what you did in order to find the effectiveness of your intervention in that you have diagnosed. And this is quite interesting because we can see this is a dynamic process of decision-making that requires specific knowledge, but who is in the process? Who is in the process? What, why, and what for? And this is, we need to stop sometimes and to think in this, because this is quite a basic information, but we need to stop. We need to stop and go back to the foundations of healthcare provision and delivery to think in what are we doing, who is doing, why, and what for. We do need this discussion today. So when we look at what can we do to bring the assessment of resilience and spirituality into healthcare. And this is just two topics because we try to be simple in this approach. It's all about communication and it's all about measures. But it's important to know and to realize that by a good dialogue, by a good communication, you can measure more accurately some phenomena that the scales won't provide you with that information. So the scales are very important, and you have lots of literature saying use a scale, the resilience scale, the spiritual well-being scale, the spiritual distress scale, the spiritual needs scale, the scale of that, and that. And that is very important, but it's very important for research, in a research point of view. In a clinical practice point of view, that scales could be a reductionist and difficult to use. So what can we do? A good dialogue, a good communication, looking at the patient, listening at the patient, touching the patient, feeling with the patient, and wanting to be there in that moment. Because sometimes we don't want to be there listening. We don't want to be there in that situation. So this is a back to simple rule, but is the best way of checking resilience and spirituality in healthcare. Then in this dialogue and communication, when I look at the patient, I talk with the patient, I listen to the patient, I touch the patient, I have the will and want to be there talking with the patient, I can check for internal and external resources. I can ask how was the management of past situations? What are the expectations? What usually are the rituals and beliefs of that person? How that person describe themselves to me, and how they usually respond to adversity. Because some patients, for sure, have the resources and what they need to overcome. And we just need to support. We are not resilience providers, but we need to know in order to support that patients. So why? The other question is why? And we cannot move forward from this because we are committed to humanized care. I can imagine I'm talking to healthcare providers, and all of you have in mind that you are a healthcare provider, that you look at the patient as a whole, as unique, and in all dimensions of life. You want to check a patient in all dimensions of life. So this is humanized care, is looking at the person as a human being. That is more than the sum of the parts, physical, psychological, social, whatever, because we are committed and we need to always be aware of this commitment of a healthcare provider. And on the other hand, I believe there's no such opportunity for interdisciplinarity as spiritual care and this resilience-focused care, because this is such broad areas that no healthcare provider by herself or himself can do this alone. So we need an international perspective and international work to approach resilience and to approach spiritual needs and spirituality in healthcare. Also, we need to review our ethical codes. And each professional has an ethical code, but I believe that there is a common line regarding the respect for dignity for the person as a human being. And this foundational in healthcare delivery. And we need to move forward into a realistic interdisciplinarity, because it's a nice word, interdisciplinarity. We work together, we are together, but does it work? Really? Do we do this in reality? Do we share decisions? Do we discuss decisions in a patient-centered care approach? Do we? Do we? I'm asking you, and I'm provoking you. This is not a psychologist, not a chaplain, not a nurse, not a physician work. It's interdisciplinary, and this is a big challenge to the future. Also, the why question is because the outcomes on mental health by nurturing spirituality and supporting resilience are there in evidence, are there in research, and are positive. So we cannot act as not knowing that. And on the other hand, when you provide spiritual care, when you have in your records, when you have proof that you are approaching resilience, spirituality in patients, you are providing indicators of humanized care and dignity preserving care. And by that, you are saying that you do provide holistic care or integral care. And we miss that in our quality reports. So what for? We need to approach resilience and spirituality because that is paramount for mental health, and mental health is a priority in health nowadays, and we all know that. And I repeated here the commitment of humanized care. We are taking care of people, not taking care of something different than human beings. And at the end, and I'm just in the last topic, let's check some challenges and opportunities for those who are interested in spirituality and resilience. Just some topics, because this is a broad area and brings really many opportunities, whether it's research or practice or education or management or epistemological work on these concepts or theories. So we can say that as challenges and future, spirituality is one of the top subjects in health. Look at publication. So it's a trend, but we can use it as a trend, is a need. So we need to look at this with care in a global perspective, but also in a local perspective and in an individual perspective. So resilience is related to mental health, which is also a priority in health policies, but also funding. So there's lots of opportunities for networking and look for funding to implement projects, to implement good work, to realize and to do this effectively, not just on a paper, not just on the research, but in implementation projects that could move forward the discussion into practice. Still, more evidence is needed in different settings and ages. Interestingly, resilience, the literature on resilience was first more evident in children and adolescents. This is quite interesting. Resilience was something that was most studied in that population. But now we need to check more evidence on resilience, on spirituality, or in the relation of both in different populations. And now that is happening, because you can find in the literature not only palliative care or end-of-life care, but you have children, adolescents, people living with infertility, people living with cancer, chronic diseases, mental health, so many different settings, health conditions and ages. Then there's an opportunity and a challenge for interdisciplinary research, because mostly we have nursing research, medical research, psychology research, and we need to merge these disciplines, knowledge, and to look at the problems also in an interdisciplinary approach for research. And by saying this, I think there's another challenge for multicentric research, for networking and getting funding, because no funding, no mission, and for educational programs. And this is true because we do need to train people on the approach on spirituality and resilience. We do need that. We can't wait for a natural characteristic of that person being more empathetic or more having a good communication. We do need to train this as competencies that are foundational for healthcare providers. So we have I'm bringing here with Fiona Timmins a paper that we did, and it was published in 2016, where we look for the synthesis of concept analysis research on resilience. And I just bring this here with Fiona to tell you that it's important to find gaps and needs, new ways to go and to move forward, but find objective solutions. And by doing this, I can share that this paper resulted in a suggestion for ICNP, that is the International Classification for Nursery Practice, of the term and the concept resilience that was not there. And we suggested that, and now you can find that in the nursing classification as a concept. That's something that nurses can use in the healthcare records. And this is an objective solution. And also we suggested three diagnoses, the update of three diagnoses. And then the international, there is a nursing diagnosis classification, international nursing diagnosis classification. So it's not just about finding gaps and needs and keep saying that we need that, we need that, we need more research, but doing and moving forward and providing some solutions and suggestions. So I'm more than happy I'm really happy to be here with you all, and I try to disclose the concepts, then bring the discussion into healthcare, then discuss with you the why, what for, and what dimensions, because this is really my research area, particularly spirituality. You can find my research group in social media here at Universidade Católica Portuguesa. You can have the site here. You can look for research and what we do. We are more than happy to have you here if you want to visit us. And I am available for more discussion or questions. And thank you so much for your attention, for being here. And thank you particularly to Jacqueline, Professor Jacqueline Whelan, for this kind invitation. So English is my second language, and I hope you all could understand what I say. And I'm more than happy to discuss some further questions. Thank you.
Sílvia, thank you so much for sharing so many dimensional aspects of your thinking around this very, very important subject, and coalescing the two concepts together from education and practice perspectives. So we'll just have a look and see the kinds of comments or questions that have come in through the chat function. So Bridge McCarthy has made a comment. In effect, she says the concept of resilience is very interesting, Sílvia. I'm looking at transitioning for my PhD, and resilience is a theme that's emerging from the data collected to date. So that's a very welcome comment. And then a lady by the name of Rachel has asked, can you share the citation for spirituality and religiosity relationship? And then Anne Byro has asked, at one point in the presentation, the spiritual dimension was described as being lived out individually, even if the traits are shared with others. My observation is that research on spiritual care and on resilience has been carried out in primarily Western cultures that have a strong emphasis on individualism. However, there are cultures and worldviews in different parts of the world that are primarily communal, community-focused. And she wants to know, what are your thoughts on how spirituality and resilience might be similar or different in more communal cultures, where the community more overtly defines who people are and how they describe themselves?
So thank you, Anne Biro, for your question. It's quite interesting, your perspective on this specific topic. I would say that resilience, when we look at resilience or spirituality, both are based or influenced by culture. There's no way out. So I would say that, and on the other hand, resilience and spirituality are really influenced also by the social environments that you live in. Mm-hmm. By saying that, I agree, I totally agree with you, but there's so many research now, not only on this Western cultures, but the Eastern cultures as well. But I think that we need to check more on this, and there's a good open door for that. And I think that's, for the way you describe this topic, you should be a good person to help us on this discussion. Very interesting point of view. And I do believe, I didn't do any research on that, but I do believe that the communal cultures and community may influence, resilience and spirituality for sure.
Mm-hmm. Thank you, Sílvia. Fiona, do you have anything to say on
Oh,
that
yes.
question?
Thank you, Anne. Hello. We know Anne very well from our similar decade of work together in the spirituality domain. So welcome to the session. And before Sílvia called your name out, I was just thinking, wow, what an amazing question and incredibly well worded. Could put that into an article, but of course, know you as a very good writer as well. So I think incredible sort of positioning of the question. And I think you're absolutely right. There tends to be a Western focus and continues to be a Western focus on spirituality and also a Judeo-Christian focus. And it's something, it is hard to get momentum up, and for all kinds of reasons, as you well know, Anne, in terms of moving this research area forward, isn't always necessarily a priority in a busy clinical environment or a sort of a competitive research environment. But in any case, there's certainly a lot of work to be done in relation to a more global and more communal, I suppose, one aspect of a more global approach to spirituality. So there have been moves, I guess, in the research funding areas which are helping with that. And Sílvia, thank you for your work, because you're leading out on not only research but also defining the concepts, which is fundamental basis, isn't it, for moving research forward. So thank you, Anne. Look forward to seeing you.
Okay, thank you. So we have another question here from Maria, I hope I pronounced your name properly, Kairanu, and she's from Cyprus. And she says, thank you for this event and the wonderful opportunity to meet and interact with all of you. I was wondering if there are any thoughts on organizational resilience and its relationship to healthcare employee resilience levels and practices. Sílvia.
Yeah, Maria, thank you. There's an interesting question and interesting perspective on spirituality that is related to management and healthcare teams management. This is I won't say innovative area, but there's no such research on that area as it is in clinical practice or spiritual needs. But I have a PhD students working on spiritual leadership. And because there are spiritual leadership, transformational leadership, ethical leadership, so many different concepts that all are related to helping healthcare workers. Of course, I'm talking in the context of healthcare, in finding meaning in their work and keeping motivated and finding meaning in their work. It's going back to the vocation, the vocation, the etymology of the word vocation is voc. It's something that we are called for. So a spiritual leader is a leader that nurture resilience on people, spirituality in people, really connected to this ability to help them in finding meaning in their work. And this is quite interesting and and we need more evidence on that. Thank you, Maria.
Okay, thank you. Fiona, have you anything further you would like to add there?
Just to say, welcome, Maria, another international colleague of Jacqueline and Sílvia and myself. So welcome to the session, and a very interesting point for sure, absolutely. Organizational resilience, important, and it's essentially important going forward. But as Sílvia said, I guess not a huge amount on that topic for the moment.
I suppose Michael West, CBE in the UK, wrote a big report on courage to compassion, and he's actually covered some aspects of organizational resilience within that context. But this is not work. This work is not solely aligned with spirituality. But obviously he has recommended quite a number of practices that organizations need to engage in for the purposes of trying to bring that agenda forward. But interestingly, Maria has noted that it might be an important or maybe a nice Erasmus idea, Fiona, and that's been directed at you, as you can see. And then we have another, I think it's maybe a comment from Catherine Ledden. I totally agree. I've seen there's a large deficit of joined-up thinking in relation to compassion, illness, humanized care, especially in settings where resources are stretched. There's also there's also a setting where burnout amongst healthcare professionals is very prevalent. Might you have any practical tips as to how to approach a conversation with a patient or with colleagues around this topic, or how to promote humanised care in resource-limited environments? That's an interesting question. Sílvia, any comments around that?
What a challenge. It's about, I think when we talk about burnout and when we talk about resource-limited environments, we are talking about the time, the time we have available for providing spiritual care or providing this kind of care. That is why, and I have written with Fiona and published an editorial on time. And time, you have two dimensions on time: the time you count, the chronological perspective on time, and the chronos, that is the time that is meaningful, and whether we don't count it, we just feel it. So when we talk about spiritual care, we are talking about or resilience or such topics. We need to introduce these topics while caring for the patient. There's no such thing as, oh, from 10 to 11, I'm doing medication. There's not such things like that for spiritual care. I can say from 10 to 11, I will provide spiritual care. So that is why we have time, because we can do what we should do while we deliver other types of care. So it's about time, and time is one of the most frequent barriers to provide spiritual care in literature. It's time. But I think that a well-prepared team will find the space to introduce these topics while providing care. This is not a topic easy to approach in a team, and I have no rule for that, because it's an individual approach depending on the team, on the organization, on the setting, on the people that are there, and I believe on the leader. So this is what I can say by now. Thank you so much for this question.
Okay, thank you, Sílvia. Fiona, have you anything to say?
Yeah, also really good question, fantastic. And I guess to follow on from what Sílvia has said, we're very aware of not only in this country, of course, but globally, the pressure on the nursing and midwifery workforce in relation to items that cause burnout, such as the environment, but also the staffing. So there's a lot of work at the moment in relation to safe staffing. Professor Jonathan Drennan from University College Dublin is leading out on work here in Ireland with an international team. So we're establishing here in Ireland sort of safe staff levels that would make it optimal for good quality patient care. So I think we have the double approach. One is we need to have the environment sufficiently staffed and of sufficient quality in order to support the nurses to deliver excellence in practice and in care. But then, as Sílvia said, even perhaps when we are quite time stretched, we've got to stretch that time the way Sílvia has described into chronos, that we actually, even in brief moments, that we try to have enough self-awareness and awareness of others, that we are still able to be, insofar as possible, authentic and compassionate and patient-centered. And that can be challenging, of course, in a situation where there is huge pressures in the clinical area that we're aware of, and in the context of burnout. But I guess looking at the EPIC, the competencies developed by Professor Wilf McSherry, Linda Ross and their team, focusing on those: self-awareness, awareness of patients' spiritual needs, addressing those needs and keeping that foremost in one's mind. And finally, in these time-pressed contexts, we do also get this sort of things not done, and there's a lot of work on this internationally now as well, around care left undone. So unfortunately, those more less tangible aspects of care are often that which are forgotten or left behind in a very time-pressured environment. So to things like education, advice on discharge, spiritual care, communication, support. So just to bear in mind, I suppose, as a reminder that these things remain, I suppose, important, and we do our best to continue to lobby for safe staffing and lobby for effective environments, but at the same time keep an eye on our own self-awareness in terms of doing what we can within the confines of the limitations we find ourselves in. Thank you.
Thank you very much for that. Yeah, and just I suppose linking back to the EPIC project and the competencies, the 4 competencies for spiritual care that were developed by Linda and Wilf across Europe. I suppose following on from that, then they also did produce a kind of a form of assessment. It's called 2Q SAM. And it's a form of assessment as well as holistic assessment, and it's 2 simple questions that we can ask instead of using complex models of assessment, and the questions simply are basically you know, about getting the balance right. It's what's most important to you right now and how we can best help. So it's really I suppose a process of mattering, and that can be really helpful to staff who are particularly time pressed. Yeah. Oh, Tova, you're very welcome. And Tova says, can I comment on the way we understand spirituality and how to work with patients? I'm not quite sure what you actually mean by that. Are you looking to communicate directly, Tova, if you're still there? Maybe you could advise us. I'll just check and see if she's still there. Jenny, would it be possible that you can let Tova make the comment, please?
Okay. So now you should be able to hear me.
Hi,
Yes,
Tova.
Tova, we can hear
Okay,
you.
hello. Yeah.
Good to
I don't
see
know
you.
if you see me or what. Yeah. So thank you for a very interesting and timely presentation, Sílvia. Very, very nice to listen to you. So then I come in contact with because I think the nursing diagnosis system has its words and ways of expressing this area that is different from the more Nordic one that is more phenomenological in the way of expressing what is especially what the problem or the challenge is. But I thought you did a very good job in pointing to not ending up with doing it reductionistic, but the dialogue and communication is very important. So for me, I think spirituality is not just this positive aha, it's sometimes struggle and very heartbreaking challenges we cope with. And sometimes there are no interventions else than journeying with the patient or witnessing. And also that there is this part of mystery in the phenomena of spirituality that we can't define. So I just wanted to add to it's not all in a box and kind of always easy to both understand or to follow. But I think spirituality and resilience belong together, and I just very thankful for the way you presented it and kind of showed the differences and the similarities today. So it was nice listening to you.
Okay. Thank you very much, Tova. And for, I suppose, people who are in the audience, just to let you know, Professor Tova Gisk was one of the main stakeholders in developing the competencies, the spiritual care competencies for nurses and midwives across Europe. And she's joining us from Norway, from Bergen. So thank you very much, Tova, for that. Really appreciate it. In terms of, I suppose, some final comments, people have commented this has been very interesting. And one individual is looking for, is it Maria or Marla Forrest for your email, Sílvia? Or yes, and then we have Janina Fabry has commented, thank you very much. It's really good to hear from Professor Sílvia. Excellent discussion and an essential topic. And I think that's all really that I have to say for now. So I would really like to thank Dr. Sílvia Caldeira for presenting for us today, and Professor Fiona Timmins for contributing to the discussion, which was really just terrific. And more importantly, I'd like to thank all the participants who signed up and who joined this. And I hope you found this insightful and useful to you in terms of education, research and practice. And then finally, thank you to Jenny for facilitating this session. So I would like to let everybody go now, and we look forward to reconnecting again soon. And just to say that we do have our fourth webinar, which will be held next month. And the details are available on our website. So we're holding that on the 4th of April. And Professor Bita Dobrowska from Poland, from Lisbon University, will be actually contributing to that session. And the title of the session is Spirituality. Is it the nurse's strength? So that'll be very, very interesting indeed. So we look forward to hearing Bita talk to us about that. So I will let everybody go. Please take care of yourselves until we reconnect again next month. Take care.
Thank you.
Bye-bye.
Thank you, Jacqueline.
Bye-bye. Bye-bye.
Bye.